Dr. Rachel Freedman. I'm a medical oncologist at Dana-Farber Cancer Institute in Boston, and I am so excited to be joined by three really important people here at Dana-Farber who are doing incredible work in the area of improving access to cancer care. Today, our focus is access to breast cancer and trying to improve upon the outcomes that we see in some of our most disadvantaged patients. And so I'm going to start with some introductions and we'll take it from there. So we're very excited to have Ludmilla Svoboda, who really is our nurse director of our cancer care equity program here at Dana-Farber. She really runs the show. I think she called herself the Queen Bee, which I love for our program. We also are joined by Ariana Vazquez, who is our lead patient navigator in the Breast Oncology Center here at Dana-Farber, working very closely with Ludmilla. And then we have Fabia Federico, if I said your name correctly, I hope I did, who is really running is our lead navigator for the program and also serves in our gastrointestinal oncology group as the patient navigator. So with that, we'll get right into it. I just wanted to turn to each of you to talk a little bit more about your role and what brought you to the role in any way you'd like to say it. So let's start with you, Ludmilla.
Thank you so much. Thank you for having us. So yes, as you said, I am the nurse director for the Cancer Care Equity Program, and I have always had a strong calling towards social justice, and having come from an immigrant family, from a family of political dissidents, I always was taught by my family to root for the underdog, to try to work hard to level the playing field. And, you know, when we came to this country, it was really obvious that there are two Americas. That's what my parents said, right? And I've always tried to do my little part to try to help those that are marginalized by our systems get cancer care. So thank you. That's sort of my journey.
Fabia, how about you?
Yeah, so I kind of stumbled into this role. I had been working in the gastrointestinal oncology center here at Dana-Farber for about 3 years before the patient navigation program launched in GI. I was the first navigator that they implemented into the clinics here, and I do have a background in public health. During my undergrad, is always one of my interests. I'm currently getting my master's in public health with a focus in health equity. So things just kind of lined up. Definitely doing work that's in line with my interests.
Great. And Ariana?
Yeah, so I think I gravitated toward this work because when I was in college, very similar to Fabia, I kind of found a path towards advocacy when I majored in sociology and Afro-American studies, and I saw like the disparities between the classes and the lower access to healthcare and equity amongst getting exposed to medical treatment. And I really started that passion towards wanting to kind of merge and try and treat everyone as equal when it comes to the healthcare system, because there was a real calling for that I saw it was absent when I was doing like research with like obstetrics and, you know, cancer care. So I wanted to be part of trying to lessen that inequity.
That's great. And so I know we all know that patients face so many challenges once they're being evaluated for cancer and then when they're diagnosed for cancer. I'm curious, in your day-to-day work, what are the biggest challenges that you see patients are facing today, either when they're getting their evaluation or after they're diagnosed? Let's start with Ariana. We'll go back to you.
Sure. So I think a huge one for me is accessibility in terms of like actual physical accessibility, getting to be able to get to their appointment for screenings and really making sure that they have someone that can take them to their appointment, because a lot of the people that I've been working with don't have transportation, or they're older and, you know, they have kids that have their own kids, or they have jobs. So there's really missing that piece of reliably getting to your appointments for screenings. And then I think also just the preconceived notion that Dana-Farber is an institute that they cannot afford. I've heard a lot of patients have concerns about, oh, I never went to Dana-Farber because it just seems like it's like a place that only people who are rich can go to and can get adequate treatment. And I think that holds a lot of our patients back, and they kind of just feel regulated to stay in their respective neighborhood clinics and or PCP offices for their care.
Yeah, I think you touched on some really important elements of just pure logistics, right? Logistics of getting the cancer care, and then the perceptions that patients may have about the care opportunities around them. Fabia, anything else that you can add? I know that you probably all have similar ideas of some of these challenges, but what's your take?
Yeah, I'll exactly what Ariana said, but I'll definitely add that in this role, you see a lot of um, how just like financial insecurity, housing insecurity, how all of those things kind of weave into the already complex, you know, aspect of getting cancer care. So, I mean, in Boston, housing is a huge issue, and we've really had to help navigate a lot of patients with, you know, you're on chemotherapy, you're, immunosuppressed and everything, but do you have a safe place to go? And, a lot of questions that a lot of people don't think about um, it's really eye-opening and definitely a challenge.
And cancer care, of course, only heightens all the things that people are already dealing with, right? And makes it even more challenging, given all that we ask of our patients when they're diagnosed with cancer and all the things that they have to do to be able to achieve their optimal outcome. Ludmilla, how about you?
Oh, I think I agree with Ariana and Fabia, and it's really hard to conceive for many folks that are working on our main campus, whether it's the docs or the infusion nurses, research nurses, the struggles that our patients face just to get there. And, that I think, immigration status is a really big one, fear of the medical system. A lot of our patients that we first meet in our historically marginalized communities, they have had experiences that really keep them fearful of the medical system. And so really it's so multifaceted, right? The logistics, the perception, so really all of the pieces, right? I think cancer for our patients is one of their least worries, right? They have to worry about housing, they're underemployed, financial toxicities, and so forth,